The long lineups at assessment centers may no longer be right outside, but the long list of COVID-19 testing barriers continues to grow for communities further made vulnerable by this pandemic, with experts and advocates calling this a broken system filled with inequities.
The lines are not there visually in person. They're now behind closed doors. They're behind the scenes. They're on the streets. They're in our shelters. They're in our low income and racialized communities.
With assessment centers shifting to appointment-based COVID-19 testing, Dr. Nahid Dasani, who works with people experiencing homelessness, says it creates barriers for those who need testing.
Many of the people I care for don't have access to phones or computers or internet. What will they do when they get sick? We really need to think about the inequities we're creating when we make these kinds of decisions.
Dr. Dasani says the province has been slow to update its action plans to protect vulnerable Canadians, especially after the first wave showed a one-size-fits-all approach doesn't work.
If you look up the website, has not been updated since April 23rd. And I think as we are now in the second wave, we deserve to understand what the coherent plan is to support vulnerable communities in our province around COVID-19.
Health advocates and experts have called on the province to change its approach to data collection and have targeted testing practices in hotspots where neighborhoods are seeing higher rates of COVID infections.
In Northwest Toronto, one of the closest ones was a drive-through. And we had, one senior citizen who spent $90 on a taxi to get there, be in line, do the test. That's a significant amount of money for somebody living on a fixed income.
The Premier and Minister of Health said yesterday they were aware of the challenges faced by communities seeing higher infection rates and are taking action. CityNews reached out to the province this morning asking about barriers to accessing testing. A comment was not provided by Deadline.
Now, your smartphone can help you limit the spread of COVID-19.
The COVID barriers don't stop there. A number of CityNews viewers say they've attempted to download the free COVID Alert app.
It is available only to those privileged enough to have the latest iPhone.
The app, downloaded on a voluntary basis, is meant to be beneficial in the country's efforts to contact trace. But the technology isn't compatible with all phones, leaving some Canadians frustrated.
It would have been so much easier if the government had initially requested that the designers of the app make it available for all Canadians with any functional smartphone.
Dr. Dasani tells me that there have been conversations he's had with colleagues at assessment centers who say there's discussions underway about allowing walk-ins for people experiencing homelessness. But he says that it's vital that the provincial government develop this coordinated plan to be used for communities across Ontario. For City News, I'm Faiza Amin.